And and I think it's still deferring to my Surface. It's picking up that camera rather than my Logitech camera, so I think I'm just gonna leave it off.
Okay, that's fine. I just wanted to let you know we saw it briefly. All right, Sheriff Landers. Sheriff Landers.
I'm here. Good afternoon.
Okay. Yep, we hear you.
Okay, we are live.
Casey, are we ready?
Yep, we're live, guys. Oh, yes, we're live and we are rolling.
Okay, good afternoon, everybody. It is Monday, August 17th, 2020, and it is 3:01 p.m., and I'm calling the Lincoln County Board of Commissioners meeting to order. We are meeting again remotely today due to COVID-19. We do have a quorum here with all three commissioners. We have Commissioner Hunt by video and audio, and we have Commissioner Hall just on audio today. We have camera problems for Commissioner Hall, but we do have a quorum present. We did do sound checks just a minute ago, so we are able to hear everybody. First up is the adoption of the consent calendar, which is quite a long one today, but these are items of a routine nature that either commissioners or staff can pull for further information or discussion. Yes, Commissioner Hall? Oh, we see you.
All of a sudden, okay, I think I've solved it. Sorry.
Yay, all right.
Very good.
Yay, perfect. So do either commissioner or staff need to pull anything off of the consent agenda, or I will entertain a motion if not.
Madam Chair, I move for approval of the consent calendar as presented.
I'll second it.
Okay, all in favor say aye. Aye.
Aye.
Aye.
All right, motion carries. Next up under reports, just before we kind of jump into this, we have Lincoln County Public Health COVID-19 update by Rebecca Austin, and then a school district update from Karen Gray, who I don't think has joined us quite yet, but is planning on being here, and then a phase 2 update. I don't necessarily see these things as three separate agenda items, so we're probably going to be kind of flowing between all of them. So I hope that our Public Health Director, Rebecca, can stay on through all of A, B, and C. And like I said, my guess is we're kind of going to go back and forth between all three as we have that discussion. But first up, we'll start with Rebecca and have our COVID-19 update.
Sure, thank you. This is Rebecca Austin, the Lincoln County Health Department Director. And I will start out with my kind of standard, the 3 C's. So the data is the first thing, or the counts. And to date, we have 440 positive cases. We've conducted 7,202 negative tests, and we have 11 deaths. So we also sent you some data on a couple data charts that I wanted to show you, and I think Christy has them. Yes, here they are. So I know we were talking a lot about where our cases are. So this first one is kind of the trend that we are looking at over time. So you can see the high spike there is our Pacific seafood outbreak. And then as time goes on, we have little pop-up spikes here and there. And we were fortunate enough to get some labels put in so you know what was happening, at least policy-wise. At the same time, we were experiencing these case spikes. So that's just an interesting thing to look at. Of course, we would like to be where we were on the left-hand side of the chart, but we are not quite there yet. And you see that we kind of go up and down and up and down. And yeah, that's what we got right now.
May I ask a question about the chart?
Uh-huh.
This August 5th little spike that comes up, is that in relation to a specific workplace outbreak, like a nursing home, or is that kind of community spread, or do we know what that spike
I
is
think
from?
that was our long-term care facility up in Lincoln City.
Okay,
Spike.
thank you. Commissioner Hall, or we'll start with you. Do you have any questions about that data set?
No, not right now. Thank you.
Okay, Commissioner Hunt, anything on that data set?
Well, for some reason, I didn't see the charts, but as I think everyone knows, track the data daily. So it may have been presented in a different format, but I'm sure it shows basically the same information that I have.
Okay, thank you. Go ahead, Rebecca.
Okay, and then the second chart is just to look at the testing, which we talked about last week. And we wanted to show like two different things. So on the right-hand side represents the bars, the brown bars and the green bars. And those are test results that we got back. So the brown bars are all the negative tests and the green bars are the positive tests. And then on the left-hand side, we juxtaposed it with the positivity rate. So that's the percent of positives that we got from the total number of tests that we did. So that's the single, I think it's kind of like a blue line, blue or black.
So,
whatever.
Rebecca, I'm going to interrupt. Is there any chance that Christy could email the charts to me so I could pull them up on my laptop? I'm not getting them on my camera.
They're in
My
your
phone.
email, Doug. They're in your email attached to the packet on the third and fourth page.
Okay, so if I go to the agenda, okay, I'll find them. Thank you. Sorry to interrupt.
No, that's fine. I want you to be able to see these. So the single line is the positivity rate, and that's something that it's a metric that we have to stay, I believe it's right around 5%. And we're not there. We dipped down for a while in July, towards the end of July, but now we're back on a trajectory that's going in the wrong direction. So, and that doesn't include last week's data. So I do believe our positivity rate did drop some last week. So we might be headed down again, but we'll have to refresh this and look at it again. But that's kind of how things are going. And you can see there, the big spike again is the Pacific Seafood is the positivity rate. And then the couple brown bars that go up matches all the testing that we did after that to sort of get our arms around that outbreak. So that's why you see the spike a little bit later than the positivity. So are there any questions about that? And I didn't stack them this time because I think it's easier to see the positive next to the negative on the bars, just so you can see, you know, kind of how it plays out.
So Christy, I can't find the charts on the agenda packet on the website.
It's in your email. The website's having issues right now, and I wasn't able to get it up online. So it's attached to your email.
When did the email go out?
Let's see.
Oh, adjusted pack. Okay, 11:54. Okay, hold on. Sorry, I'm being difficult.
It's okay.
No,
We'll give you a second.
But while I'm looking, Rebecca, the math, I'm confused with the math on the number of deaths. The media release that went out earlier today said we had 4 deaths and we were at 9 before, so that should be 13, but you said we have 11, so could you
Yes,
clarify?
Yes, I will clarify that. Thank you for bringing that up. So 2 of the deaths that we attributed to being COVID related are actually still in process. We're still waiting to get confirmation of that. So that was just a human error on our part. Apologize to everybody that's involved in that. So we don't know about 2 of them, if they were COVID related or not.
Okay, thank you. And I do have the, excuse me, go ahead.
No, I was just gonna say Susan has been scrambling the last 20 minutes to get everything updated. You know, it's not just in one location, it's in several. So she's been scurrying about to get that changed.
Yeah. All right, and I've got the charts in front of me. Thank you, Christy. Okay, I have no questions. Sorry, I interrupted.
Commissioner Hall, any questions?
Yeah, I guess at this point, maybe, I think these are both, would be a good time to bring this up to Director Austin. I mean, both of these charts are very helpful, and I appreciate the, you know, all the work that goes into pulling the data together. But what's not captured here, I wonder if either now or later in your presentation, we were going to revisit the question of access to testing and number of tests being performed. And I know that's been an ongoing concern for us for a while, and, you know, statewide as well. And, you know, as we move ahead, you know, I'm just wondering if we are seeing any daylight on that problem, and if there's anything, you know, I think it's really seems to be more a state and federal issue, but whether there's anything we might be able to do locally that we haven't done yet to facilitate more access.
Yes, thank you for that question, and I will try to address it. I have some, I have a request out to Samaritan to send me their information on how many people they're testing, because they are a huge contributor to the number of people that we're testing in our county. And just with some conversations with some of the folks at Samaritan, it seems like we might be hitting our new normal. So in other words, you saw the spike around 6:20, and that really was in response to our outbreak. All hands on deck. We did several mass testings. And then the more testing you do, of course, the more contacts you're going to get. And so the more, you know, that just keeps generating itself. So we saw that over the next 3 weeks, 4 weeks maybe at the most. And then the week of the 25th, we saw it really drop down, and it's hovering around 200, 150 to 200 tests a week now. So, and we can't really figure out why that is, other than we just may not have the people that are symptomatic that are getting tested, but we're trying to figure out what's going on at Samaritan to help us really analyze that situation. So, and I don't have that data yet back from them. So, you know, they do an outpatient where people that do have symptoms and have a doctor's order can go and get tested. And then they also do an inpatient. So anybody that's coming in for a procedure, they come in a few days early and get tested to make sure that they don't have COVID before they do the procedure. So we're just trying to get a handle on whether it was inpatient, outpatient that are going down. We don't have a real clear picture of that yet. So that helps. I do believe that's true. I think the whole state, like you said, and the country is also noticing this decline in testing. And I guess I really can't put my finger on exactly what is going on. It doesn't appear to be a supply issue. It doesn't even really seem to be a turnaround issue, which we have had both of those issues. But you can see from early May, or early June, I mean, until current, that really has not had a lot of bearing on the number of people we tested. So if you take the 620 anomaly out of there, you can kind of see that we're slowly marching downward. And I I wish I could tell you why that is. I don't think it's an access issue. I think we're still following the guidelines of unless you're going into the hospital to have a procedure, we're testing people that are symptomatic. So if you have some kind of symptom, you can get tested. Now I understand, I have not been able to confirm this yet, that more testing sites are coming on board. And whether they are following the guidelines from the state and will only test symptomatic people, I do not know. So we'll have to see how that plays out. But I do think, generally speaking, that the supply and the access isn't our issue right now. It may just be we don't have that many symptomatic people that are willing to go and get tested. But I can't say for certain.
Thank you. That's really helpful. That's the only question I have right now.
I have two questions. One is just on the topic you were just discussing. How does workplace testing fall into sort of testing numbers? Because in the past, we've had some very large employers, test their whole crew, which that particular week means testing shot up, 2 or 3 times what it was previously. Because if you have 300 employees or something like that, you test everybody. That's a lot of testing. Have we had a lot of large employers do testing recently?
Oh, nothing like the 300 that we had for the PAC flu. No.
Yeah. Okay.
I think the other high number of mass testing that we did was the high brown bar there. That week we did our mass testing, which was over 350. And then at the same time, there was all the long-term care facilities. A lot of the long-term care facilities were getting tested in many smaller workplaces. So that's why we had such a spike.
Yeah.
And I do think that the hospital was bringing on more people to do procedures with. So it all kind of contributed that week to a very high number.
Yeah, and then shortly thereafter, we had the OSU Trace Project
Exactly.
as well. So their
Yes.
numbers are in there, as well as late
Yes.
July too.
So I would say we haven't seen numbers like that since the beginning, right?
So then my second question is looking at the health metrics that OHA posts every week, which do have a tendency to kind of fluctuate. One of the ones I'm a little bit concerned about was percent of cases in last 7 days with follow-up within 24 hours, and it should be at 95% or more. Typically Lincoln County, I would say either meets that or kind of hovers, like we're super close. And I understand that it's not just on us. People actually have to call you back in order for that metric to be met. They have to have a phone number that actually works and that kind of stuff. But we're down at 54% this week. And I was just curious, what happened with that?
Yeah, I think that actually is a metric from 2 weeks ago. And what we think happened, and I'm trying to confirm this, so I haven't got confirmation yet, but looking at the other counties that also had low numbers for that week, it looks like that's when we are all coming on to Arius, which is a new platform that the OHA put out for our contact tracers. So we're all in the process of switching over from our paper to electronic platform. So we're thinking that that's probably what happened because our process really hasn't changed. We've been doing the same thing right along. So that's what we're thinking, but I haven't got that confirmed with OHA yet.
Okay, I appreciate that because like I said, we're typically there or very close. And that was definitely concerning. I mean, just is not typical for us.
I did talk to our nursing supervisor about that, and that's definitely what she thought was going on too. And when I look at the other counties that were also really low, they were also coming on the same time we were. So I think it's just a data glitch, and that should straighten itself out. when we
Okay.
see the next update. Yeah.
Yeah, thank you. I'm looking at it now, and as I look at other counties, you're right. Everybody, not everybody, but a substantial number of them seem far under that number as well. So it looks to not just be an us issue. So I appreciate that
Yeah.
clarity.
Sure.
Yeah. All right. Any other questions for Director Austin, Commissioner Hall? Any questions? And I hope you stay on with us, Rebecca, through our other two discussion points.
So yeah, I just wanted to mention a couple of concerns that I have. So that was the data piece. So if that's all right, if I take
Sure.
that time.
Go ahead. Go ahead.
Okay. So a couple concerns that I'm seeing and just want to alert you to is that we're seeing more and more cases that are coming up in lodging operations that are among housekeeping and front desk staff. So this could indicate that travelers are bringing the virus into the community. You know, we've been looking for some clues that that might be happening. We can't put our finger on it completely, but since it's kind of a new phenomenon, we are trying to, and a lot of those cases are sporadic. So it makes, they're not, socially, like they didn't all get together and have a party the night before, 2 nights before. So we're kind of looking at that. I just want you to be aware of that. And then also just to let you know that we are starting to have some concerns about the workforce weakening and some burnout, signs of burnout from staff. So I think it's important that we start thinking about ways that we can mitigate that. Because like we all have said, I think saying it and believing it and preparing for it are two different things, but we've all said that this is a marathon, not a sprint. So if we're going to be in the marathon, we need to make sure that our workforce has what they need to, maintain their own wellness and, feel like they can come to work every day and do their best work. So that's all I had for my concerns. And then for the community aspect, I just wanted to let you know that we have, we're in the process of hiring 2 bilingual community health workers that we're very excited about. One will help out with access issues for our federally qualified health center. And the other one will be attached to our communicable disease team to reach out to our Latinx population to make sure that they have the information that they need. A lot of the work that we've been doing, but they will carry it forward and make sure that we have an ongoing presence. So they will be a regular employee of ours, and they will be trained up in contact tracing and health education and a lot of different areas, learning all the resources that we want to make sure that people are aware of. So we've got, we're hoping to keep moving that along and get these folks on board as quickly as possible. And I think that's all I had.
Well, that's really good news about 2 new people joining our team. And I know that the recruitment is underway too for replacing our deputy director as well. So hopefully things go well on that too. So we can continue to have a full staff.
Absolutely.
I do have some other comments and questions, but I will let Commissioner Hall and Hunts go first, and then I will finish it up. So Commissioner Hall, questions or comments?
Yes, thank you, Madam Chair, and Director Austin. Thank you for flagging the issue of staff burnout. I have seen and heard enough to, not be surprised by this, but to be very concerned. And, I think at least initially I would certainly appreciate, and I imagine my colleagues would as well, if you can see any solutions. I don't know what it would take in different allocation of resources, whether we can bring in more resources. I know these days trained communicable disease nurse is worth their weight in gold, but anything we can do to assure A, the health of our and wellness, well-being of our staff, and B, getting the work done in the community, I'm certainly open to further discussion of that. I think it really needs to be a priority for us. And then on the cases of confirmed cases among lodging employees, can you give us, or if you don't have it now, could you get to us? I mean, some idea of what we're talking about. I mean, whether it's 6 or 24 or 50, when did this trend start showing up, and some sense of what those numbers are, I think would be really helpful for us. Thank you.
Sure, I can definitely get some numbers for you, and I can tell you that that trend started when we started seeing cases up in Lincoln City.
All right, Commissioner Hunt, questions or comments for Rebecca?
Well, I'll start with a follow-up to that. When did we start seeing the cases in Lincoln City,
Oh
What-
gosh,
calendar-wise?
I would say the end of July.
Okay. So you talked about the new software program that is being used to report testing and that sort of thing. As I look at some of the numbers that I've crunched, and this is data directly from the daily Oregon Health Authority reports, I show for the month of July, our percentage of positive tests was 3.2. I show month to date, i.e. through the 16th, our percentage of positive tests is 9%. And if you look at the last 3 weeks, we've gone from 4.3, where it was, I believe, Saturday, August 1st, to 9.4 on Saturday, August 8th, and 8.7 through August 15th. My question is, are you comfortable with those numbers, because they reflect data that's been reported and wouldn't be anomalies or inaccurate data because of the reporting systems?
I'm comfortable with the reporting, yes.
Okay. Thank you. That's the only question I have.
Okay, thanks. A few questions or comments I would just second what Commissioner Hall said on definitely needing some more information on kind of cases in lodging operations. And besides just the numbers, I guess I'm curious, is it one particular facility or multiple, lodging facilities? I think that would be helpful, as well as the numbers we're looking at and the period of time. I think especially before we again relook at the 24-hour hold, I think that would be helpful. Although it sounds like those are in Lincoln City, so our hold, doesn't apply to those anyways. But I think that'd be helpful for Lincoln City to know as well.
Mhm.
Second, when it comes to our workforce, I just feel like anything we can do, we have to do it. I also just want to say that I know there's a really intense workload, but I don't think it's just a workload issue. I think it's the kind of work as well that they're doing. This is incredibly difficult stuff. We're talking about them working with people that are sick and potentially dying and have a very scary illness. And we are an organization that really preaches mental health and provides a lot of mental health services to our community. And I just want to be making sure that we're taking our own advice to heart, and that we're making sure that our own employees that are dealing with some really hard stuff and their workload also have access to that, and that there's not barriers in place for them. So just anything we can do.
Yeah, and I would echo that for sure. And it's really not just among public health staff, but really all of HHS that's dealing with trying to keep people as healthy as possible. We're all under extreme stress in trying to do our jobs. And, it's just, trauma is really intense across all of our workforce. So we got to figure this out for sure.
And so I think I, would really appreciate some, I'm not asking you to spend 8 hours of your time outlining a very precise document on what to do, because I know you're busy, but I think even just a brainstorm of things that would be helpful, for those specific people in that department. I can think of some things as well, but I of course would like to take feedback directly from HHS. So I think just a list of things that would be helpful would be helpful to us in trying to take some action as quickly as possible to address some of that stuff.
Sure, I'll definitely try to get
Yeah.
something to you. Mhm.
Yeah. And I know you and I have had some quick back and forths, but like I said, I think kind of an extensive list as best we can so that we can start picking off the low hanging fruit and then working on the harder stuff as we essentially continue to run this marathon would be helpful.
Mhm. Okay, thank you.
Yeah. All right. Thanks, Rebecca. I hope you stay on with us.
Sure, I'll be here.
Yeah, thank you. So moving on in our agenda, I see that Dr. Gray is with us, and I think you missed the very beginning of our meeting, which was fine, but I was telling everybody, Dr. Gray, that items A, B, and C in our agenda are update from our Public Health Director, Rebecca, and the update from you, and our phase 2 update is kind of just one big melting pot of information. So we'll probably kind of weave in and out of all three of those things. So I think we'd like to do an update from you with time for questions and comments from commissioners, but I hope that you'll stick around for our phase 2 update as well.
I can stay on until 4, and then
Okay.
I have a 4 o'clock meeting, so I'll have to go then.
Okay, understood. So yeah, I guess if in the context of how this came up and wanting you here is really in context of our phase 2 application and having concerns that maybe we would not be able to pull off both. But then I also know that things on your end are just constantly changing with guidance that you're receiving. So even though I know you and I have talked, Dr. Gray, I think it was just time for a kind of official update to all of the commissioners and the public around kind of what the school district is at and what the plans are currently, even though we recognize those plans change.
Yep. Over the last 2 weeks, we've met with over 1,400 patrons on online meetings, including meetings with tribal members in council and in Spanish and in Guatemalan dialects. I feel like our outreach has been tremendous to talk about our plans. And then, of course, we have our newsletters with another one that just went out while I was listening here. Our schools can't open, so even before the governor put out her metrics, we had already made the decision not to open because there were too many cases in the community. So we moved to what's called comprehensive distance learning, which is an all online accessed education that is not the pandemic and crisis learning we did last spring. Last spring, everybody stayed home. They did what they could do. Things changed on us every day. And so comprehensive distance learning is much more like school, but accessed through an online tool. We're expecting our teachers and our staff to be working from school using all of our blueprint for reopening protocols that we have been required to give to the state, which we did last week. And those are about 20 pages worth of safety protocols. We have 150,000 masks, about 2,000 shields, pallets and pallets of sanitizer, and about 20 cleaning protocols and safety and outbreak protocols. We were required to trot our plan over to our local health authority, which we have done. And I know that Rebecca and her team have been incredibly busy. And we also have not received any feedback on our plan. And so our plan went into the Department of Education without feedback. We know that if you had the time, you would have given us feedback, but it was due last week and we just had to turn it in. So that's pages and pages of safety protocols and outbreak protocols of what happens when you begin to have staff and students back on campus. We cannot have students back on campus. Now, on the 11th, which was last Tuesday, they came out with their third and final guidance for school districts. And one of the exceptions that is a statewide allowance for what they're calling limited in-person instruction is the following: that there have been no confirmed cases of COVID-19 among school staff or students in the last 14 days. So let me say that again. There is a statewide allowance that allows you to not follow the governor's metrics for state or county. If a school, a particular school, has had no staff and no students with any case of COVID within 14 calendar days. And by limited in-person instruction, they mean you can have a kid of up to 10 cohort, so 10 kids in a cohort, and they can't be exposed to more than 20 kids or 2 cohorts in a week. And the bus counts as 1 cohort. So you can only put 10 kids on a bus because the cohort is limited to 10. And the bus, if a child comes in by a bus, that counts as one of their 10 cohort. You can only be on campus for 2 hours continuously. There's no intermittent going to school, no recess, and lunch is a takeaway. It allows various groups of kids to come back in this in-person limited model using all of your blueprint for reopening safety protocols, which are posted on our website. So we need to know from the county their methodology of how we're going to know if any of our 11 schools can qualify for this in-person instruction, which we would like to pursue. But that information isn't coming from the district. It's coming from the local health authority. So again, asking Rebecca and her staff to do more work. Susan Van Loo, my assistant superintendent, is going to be asking Rebecca for this information. So I don't know how you do that, because you're not really going to know what the cases are, because not everybody gets tested and not everybody reports. But this is with regards to who is reported to the county. That's a confirmed case. And if I can find a school or schools that meet that requirement, they don't have to meet the county metrics or the state metrics.
So Karen, I just want to make sure I kind of understand this from a process end. So you are able to get K3 back if you don't have a school. Oh,
No.
sorry. Oh, sorry. I said it. Okay. Go ahead.
That's a different one.
Oh, okay.
That is not the same. So I'm only talking about in-person for specialized groups.
Okay.
Nothing to do with K3. K3 is a different statewide exception, and that is for 10 to 30 cases per 100,000 population. We don't meet that metric. So we cannot open K3. I hope we do at some point, but we cannot.
Okay. Sorry. Thank you
Don't worry.
for clarifying
Hey,
that.
listen,
So
I barely understand this.
well, that's why we have you here today.
Not last Tuesday.
So for specialized groups, right? Am I
Right.
calling that the right term? Okay. So for
Yeah.
specialized groups,
Yep.
you need, and I want to make sure I'm understanding what you're asking public health for. You need public health to confirm that you haven't had any students or staff from a particular school test positive in a 14-day time frame.
Correct.
Okay.
We bantered that for about an hour this morning in our executive team meeting, trying to figure out any suggestions we'd give the health department as to how to do that.
And then I'm assuming you would need to constantly, every 14 days, I mean, you would need to, that's a constant thing. It's not
I
just
think
checking
it's
in
like
once.
every day.
Yeah.
You
Okay.
have to know.
Yeah.
But at least it's giving us an opening. And the last thing is, you can't be baseline. So Umatilla, they took back to baseline. They couldn't open for anything because they're not even phase 1.
Yeah.
So phase 2 helps us in the area of athletics. We might be able to open up a little bit more if our county was a phase 2 county.
Mhm.
That's about the only area that helps us. Phase 1 is fine for us. It's these number of cases and the positivity. You know, when you have 9.2%, we can't open.
Mhm.
So they're trying to give schools, individual schools in the state of Oregon, a way out. Now, if you get to do that instruction and you do it with these teeny weeny cohorts for 2 hours a day, you can also open for limited daycare. So we need the daycare. So,
Yeah.
you know, I'm looking forward to the meeting with United Way that's coming up. And I've also queried KinderCare and Champions, who are both daycare providers, to see if they'll partner with the district. But if I cannot open even limited in-person instruction, I can't have any daycare whatsoever, not even third-party purveyors. Because believe me, I've checked and I can't. So that's what we're needing. 2 things from the county health authority is we need to have a process for checking all 11 of our schools. And we need feedback on our plan. Because we turn in a plan we think is really good, but we're not health people. And we just need some feedback to make sure that Rebecca thinks we're on the right track. I just want to make sure.
Okay. All right. Thanks for that. And I do want to give Rebecca a chance to respond. But first, I'm going to see if Commissioner Hall and Hunt have any questions or comments for you. So Commissioner Hall.
No questions. This information is helpful. Thank you.
Okay, Commissioner Hunt.
So I guess no surprise, I'm confused. If I understood what you said correctly, Dr. Gray, if you have one school, so let's pick a school, Ocean Lake and Lincoln City, if they have no positive cases of faculty or students, then they could open face-to-face, even though Taft High School had one case, they couldn't open. Okay, and again, it can be either staff or students.
You can't have any.
Any,
So
zero,
it doesn't
okay.
mean Staff or students, it's a big fat 0.
Okay, and I guess this is a question that really is more your challenge than the county, but it's got to be terribly cumbersome to try to open one school in one area. And then, I mean, in Walport, you've got schools that are virtually, they have common properties. So you could have the grade school open and the high school closed. Wow.
You know what would be
Okay.
hard there is though, I don't think so maybe.
Pardon
Because
me?
I think Walport schools, I think they go together. Well, unless the school, yeah, you're right, Doug. Because if the one school had staff, yeah, you could have literally one could be open and one not. You're exactly
Okay,
correct. And not only that, they don't virtually, they literally share a hallway.
Yeah. Yeah.
You're correct. Sure.
All right, thank you.
Yeah, you don't seem confused at all. That's exactly
Well,
correct.
You provided very detailed and clear
Yeah.
instructions.
One other thing before you speak, Commissioner Jacobson, I just want to say that the other model of schooling I didn't get a chance to talk about is just a fully online K-12 option. So I want the Board of Commissioners to understand there are two options. One is comprehensive distance learning, which is crafted and designed by a teacher, and one is Edmentum, which is done self-paced and kind of offline from the school district, but completely online. Just so
Yeah.
people know.
Yeah, thank you for that. And the one piece of feedback on the Edmentum that I've heard a lot from parents, and it sounds like maybe you're already working on this, is that originally it was kind of a requirement that students check in and complete work every day, 5 days a week for attendance. But I know that it's been concerning for some parents, what if the people trying to work and all this kind of stuff, if kids, especially older kids, invested 3 days a week or whatever and kind of got their work done, would that requirement for 5 days a week of check-in and schooling really be required?
Right.
So
And the State Department is adamant.
interesting.
Every
Yeah.
single day, 5 days a week, attendance. Yep.
Within that 5 days a week, my understanding is you'd still be able to do work on a Saturday, for example, but you still would have to go in and complete work or check in online on the Monday through Friday piece.
Absolutely correct.
Okay. What's the kind of consequence, even if your work was completed and you were on progress to finish your course, if you didn't check in 5 days a week?
I don't know.
Okay, I was just curious at what
What
happens if
we
you
would
didn't.
do is we'd have to call you and ask the parent, because here's the deal, you guys. They just don't want it to be like the spring where you check in, you don't check in. I'm in my pajamas, I'm teaching from home, I'm in a closet. I mean, we just can't do that anymore. It's got to be pretty robust and pretty real. And, our average daily membership is how we get paid. And plus, it's important for engagement. And we lost our engagement last spring. We just can't afford to do it. So, I listen to what Rebecca says about being overworked and overloaded. And I want to tell you, the school district isn't any different. It has been a really exhausting, what we call change fatigue. Everyone's getting whiplash from all of these different requirements and guidances, and frankly, the inability to make people happy has been really hard.
Yeah, I think many of us have experienced that.
Yep.
So Rebecca, do you want to respond or? Oh, can't hear you.
I'm happy to respond, sure. So just like every local public health authority in the state, we're sort of overwhelmed and like, you want us to do what? So that guidance has been changing as well, what public health's role. And I think what they finally settled on, Dr. Gray, correct me if I'm wrong, is that once we receive your plans, we need to do a letter saying that we did get your plans and that we will be reviewing them. But that's my understanding anyhow. And of course, we have set up some work groups to do that very thing. And we're now trying to figure out, I think the most important for us is that section 3, when you do get outbreaks, because I know all the plans are for opening up in your limited way when you don't have any cases. But our sense is that we could probably say that in the next day that will change. So, there's a lot of concern that maybe not everything is being looked at in that regard, that we could have a parent, for example, that has tested positive and has 3 kids that go to potentially 3 different schools. And are we going to count them as positives? They could be presumptive. They could be without symptoms and we wouldn't necessarily get them tested. So will we have to up our testing game in order to get them tested before we could assure that they're safe to go back to school? And then how long can we keep them safe if they have a parent at home that's quarantining with COVID? So
Yep.
It's very complicated. And of course, we're going to review your plans. And like I said, that third part of when you really do have an outbreak, how we communicate and how we nip that in the bud as quickly as possible is our biggest concern right now. And we do have a couple nurses that are going to try to free up some of their time to begin to look at that and talk with your nurses and your staff that will be helping us really hone in on that process so that it has very few flaws in it when we actually have to put it into practice. So that will be a process that we have got to address. And I guess I was thinking that we had, 9 weeks to get our act together, but it sounds like maybe that is shifting and we won't have those 9 weeks, especially if you want to do the limited in person. So I will try to get this higher up on the list and get back to you on some of our feedback for sure.
You
That's
guys are
definitely our
terrific
intention.
partners. I have no complaints.
Yes, no, I feel the same way. Like it's all a huge undertaking, and I think you've heard me say before that getting even the limited and the K through 3 is a big priority that I have because I know that that's probably our most important populations to get back into the classroom. So
Yes.
I hear you loud and clear, and I know that we're all under a great amount of stress. So where I feel like we're all doing the best we can, and I hear across the state that everybody wants to know what the heck is Lincoln County doing? They're getting along so well and blah, blah, blah. So, and we did nip our big outbreak in the bud. So I think just, talking, keep doing what we're doing, communicating and, working through things is how we're going to move forward.
Thank you so much.
Yeah, and just one thing I wanted to say, I know you have to go up for Dr. Gray, but just one last thing I wanted to say in the note of collaboration is just a big thank you. We had many of your staff members that reached out to us during our large outbreak. Many that were bilingual, bicultural, and offered to help, that worked in our call center, that became contact tracers, that just connected with families that they knew personally. And they just became kind of a backbone, a lot of the work that we did. So just a big thank you to all of them that just voluntarily, kind of stepped up and reached out and said, how can I help? So you got some great staff as well. Oh,
These
and
are all our people.
Commissioner
All
Hunt
ours. All
has
ours.
a comment.
Yeah, again, I may be confused, but you talked, Dr. Gray, you talked about, I believe, a K third grade program or sector, and then the other grades. And I guess my question is, the two criteria for schools are case rate per 100,000 and test positivity. And right now, Lincoln County doesn't meet either of those. Does that affect all aspects of the school district operations or just one part of the different programs?
Really, the bottom line for me as a superintendent is around the number of cases in the test and the case positivity. That's really the bottom line feature for most of what we think about in the school district. I think that the governor is getting an incredible amount of pressure to do something about special education and English language learner students who are not only falling behind, but they're so behind, we don't know how to catch them up. And then kindergarten through third grade kids need in-person instruction more than anybody else does. They do the worst in online learning by themselves, frankly. So I think all I can say, if I understand what you're saying, is they're trying to give us an out, but it's really very particular to these smaller groups of students. The exceptions are not really that helpful. Because really, if you look at the fact that you have, again, it's the no confirmed cases. Our staff works across the county. They're not Newport staff living in Newport. We have interdistrict transfers that are all over the place. Our special ed program at Newport High gets kids from every aspect of this county. There's no real way to tag it down. So until we go down and stay down, our whole district is going to be online for a long time.
All right, that's very helpful. Thank you. And again, I think the leadership that you've provided and the support that the staff of the school district have provided to the county is exceptional. So thank you.
Thank you so much. Thank you.
Thank you. I'll let you go. I know you got a meeting at 4.
Thank you so much for inviting me.
All right, so moving on in this conversation to our phase 2 update. I will let Wayne Belmont, County Council, kick us off.
Thank you, commissioners. The first thing, we lost Dr. Gray. I was going to ask that the one question I had is phase 2 does actually allow us to open up certain venues and events, recreational sports, indoor and outdoor activities. And I'm not sure that I heard what the school district was planning in terms of any of those activities, separate from what they might be doing to open up the schools. And I'm not sure if that's a question you want to have answered. We could ask later.
I did hear her say, and I took a note, that phase 2 actually would allow some athletics and additional programs to take place. I had written that note down of what she said. Yeah.
And maybe we can work on getting more information related to that so we know how that works. So to get back to the update, of course, we made our application on August 6th to the state, but chose a target date of August 24th to go into phase 2. But with some caveats that we would be continuing to monitor our progress as we got closer to that date and have discussions with the Oregon Health Authority about what's happening both on a local level and the trends we're seeing here and what's happening on the statewide level. And so the first thing I wanted to do is indicate that I really appreciate that Director Austin and her team are putting together trends that you can look at, the graphs that you had that you can look at over a longer period of time. One of the issues that we've been trying to grapple with is the fact that the public health indicators that we look at are really point in time measurements, and they fluctuate. They go up, they go down at any one 7-day or 14-day point in time. So looking at this on kind of a larger trend basis, I think is what you've been trying to do to really see where we're going. And these graphs do show the kind of volatility of cases that have come in and out of the county. And so I want to make sure, provide a caveat to everybody that when you look at our phase 2 application and you look at the public health indicators, what was met at the time of the application is different than what was reported later, and it's different than what we have today. So those are not in and of themselves a determinant of whether or not we'll move forward into phase 2. They're just part of the calculation that's made by OHA and by the Board of Commissioners. So Chair Jacobson, Director Austin, and myself did have an opportunity to meet with OHA's Director Allen, and with State Epidemiologist Dr. Seidlinger to discuss Lincoln County's application. And I think we got some really good feedback from them on where we are and where we're going. And I think the most important thing to report now is that they are looking at giving us some additional guidance and really an initial response to our application a little bit later this week. We anticipate that either Wednesday or Thursday at the latest, we're going to know exactly where we stand with our application. We discussed some concerns with, again, the volatility we're seeing in the county, but generally the trending is, it seems to be looking towards a positive result, but it may not be on the terms that we've applied for, which means it may not be on that date of August 24th. So that's part of the discussion that we had with OHA and part of the response that we expect to see coming to us. And so one of the things that I would like to do, and we can discuss more details on this, I would like to suggest that we actually tentatively schedule an additional special meeting for the board coming up here. And I would suggest late Thursday afternoon if possible, to really get that, the response from OHA. Hopefully we'll have it by that time. And if we don't have it by then, we'll schedule it for sometime on Friday, if it comes later in the week, so that we can actually announce what it is that the information is that we've received and the direction we've received, and discuss any additional guidance that may be forthcoming from OHA. So with that, I'm going to stop and let Director Austin and Chair Jacobson talk about anything else that we discussed in the meeting, and answer any questions.
I think you did a nice job of summarizing that meeting, Wayne. I would just add that they were really grateful to have a nice partnership in Lincoln County with the commissioners and yourself, Wayne, and our public health director. So I'm glad that we have good open lines of communication there. I suspect, as you said, that we will hear back from them probably not tomorrow, but probably Wednesday or Thursday with some guidance and recommendations. And so it's likely simply not just a yes, no answer, but with additional guidance or things to consider. It might be things that have to come back to a board action, or it may not be. But I think the recommendation to have an additional meeting at least scheduled for later on this week to possibly discuss or take action is important. I will just say, with having been one of the commissioners that voted to approve our application previously, with what I'm seeing now, I'm a little worried. And I might take some different action, but I feel like waiting for the OHA kind of guidance to come back would be helpful. And so we still, even after they give us, a yay or nay or guidance or whatever that may be, we still are able to take additional board action if needed. So I feel comfortable with setting up a meeting for later this week. And letting OHA know of that meeting. So hopefully they will give us the information before we have that scheduled, and we can discuss as we get it. Rebecca, is there anything you would like to add?
No, I think it's all been said. Thank you very, very much. Appreciate it.
Yeah, I guess the one more thing I would say that we briefly discussed with them, which I feel needs a lot further discussion, but just in terms of our own staff being inundated and overwhelmed, they are, of course, seeing that across the state as well, and as well with their own staff. And so there was some brief conversation of trying to create some type of pool or substitute pool or something where it would be easier to give people a break. I think a lot more discussion is needed there, but they're seeing similar issues across the state, and we're open to having some more conversation about that. So, questions from other commissioners? Commissioner Hall? Oh,
Not this time. I really think setting a special meeting tentatively for Thursday afternoon is a good idea. I know I've seen in our public comment packet a lot of folks focusing on different things. We're hearing a lot pro and con about continuation of the 24-hour hold, and I think it would be most appropriate for us to take that up and other things after we have heard from OHA.
Commissioner Hunt?
Well, my only concern would be that if we don't hear from the governor's office prior to the 24th, what would happen? But I'm assuming, and Council Belmont, correct me if I'm wrong, but if we don't hear from the governor's office by the 24th, that would mean the application has not been approved, and therefore going to phase 2 would not take place at that time.
That's correct. They would have to approve us going on the 24th, and we would have to hear from them prior to the 24th.
Okay. Well, I think it's important to note that I expect we'll hear from them, but in the unlikely event that we don't go to phase 2 on the 24th if we don't hear from them, to use double negatives.
I think that's a really good point. It's not an automatic approval just because you applied. you have to actually hear back and get approved, and that approval can be conditional or can have additional requirements attached or recommendations or what have you. So,
And
Okay.
not that it makes too much difference, but I have another board meeting I have to chair Friday morning. So when we schedule our meeting, we would be appreciated if we keep that in mind.
okay, we could possibly even do an evening as well if during the day was challenging. So
Thursday afternoon is fine if we've heard from the governor by then.
okay. Well, I am going to go ahead and just delegate staff to come up with the time. I think Thursday afternoon would be much better than the morning. It just gives OHA a little more time to hopefully respond and give us something in writing to consider. So,
Thank you. We'll do that.
okay. All right. Thank you. Moving on, cybersecurity presented by Todd Richmond, IT Director.
Chair Jacobson, if I might, before we hear from Director Richmond, I asked him to give a presentation to the Board of Directors, and it was prompted by my participation in a webinar where I was enrolled as chair of the CIS Insurance Services, which the county and I think 31 of 36 counties utilize in the state, and a large number of cities. But I participated in a webinar on cybersecurity, and it was frightening, frankly, to hear the seriousness of some of the consequences for having cyber attacks, cyber ransom. So there were 6 areas that were discussed in the presentation that I heard. And so I asked Director Richmond to give a presentation to our board that addressed those 6 areas. Not that I feel that we're vulnerable, but because I feel that the risks are incredibly high and we need to make sure we're doing everything we can to protect ourselves. Cyber ransom can be extraordinarily expensive. I actually received a letter from one of the educational institutions in the state where family members have attended, and they actually ended up having to pay a cyber ransom. So it's real. And again, because of the concern and of a high level of risks, I asked Director Richmond to make this presentation.
Thank you, Commissioner. Like you said, there were several areas that you wanted us to cover. I'm going to start by talking about ransomware. That really is our ultimate foe at this point. We've done quite a bit this last year to protect against ransomware, but I want you guys to realize that the best protection for ransomware is good backups. Preventing the attack is preferable, but not always realistic. The vectors that they're using to get into our systems change constantly, and they actually, the bad actors have access to things, to exploits, to unknown, unpatched security vulnerabilities that we don't have access to. So we're really behind the 8 ball when it comes to defending our networks. The easiest way for people to get in is through email. We've had a history of compromised email accounts, and what we've done to prevent that in the future is require 2-factor authentication on all email accounts on an initial login. All of you that work at the county have seen this, with the exception of Commissioner Hunt. We all have 2-factor enabled, and as soon as Commissioner Hunt, wink wink, updates his phone to a new model, we'll get him hooked up with that as well.
Wait a minute, I have an iPhone 11P. Is that not new enough?
Oh, that's new enough. We just didn't know that you upgraded, so we'll get you hooked up.
Okay, we'll take care of that issue soon. Sorry to interrupt.
No, So that's been very helpful for us. It's not perfect, but it does make us less of a low-hanging fruit, which is really only our goal. Like I said, we can't necessarily prevent all the attacks, but we want people to look at us and say, nope, that's too much effort for the benefit. We're not going to get enough money out of this organization to make compromising it worthwhile. So the other thing we've done this year is implemented a system of file. The product's called Varonis. I'm sorry, did you lose me?
We lost you, but you're back now, I think.
Apologize for that. Commodity internet is just not great. The Varonis watches files and it looks for the actual attack, so it can shut it down. So we have a whole host of metadata now as to access for files on a per file by user level that allows us to go through and say, why is Casey Miller touching 1,200 files today? So that's huge for us because a ransomware attack touches a lot of files very quickly. And what this software allows us to do is to say, if we see files in mass being encrypted, stop the process. It actually kills the affecting program that's encrypting all of the data and stops it in its tracks. And that would allow us to then restore from our backup, which is the other thing we've done this year, is a new backup system. When we were compromised in August of last year, if they'd been successful at encrypting our data, we would have been down for weeks, literally weeks, restoring from backups. We wouldn't have had to pay because we have good backups, but we would have been down for a significant amount of time. Our new backup system takes those weeks and turns them into days and hours. So if a machine is compromised, I can kill it, erase it, delete it, and have a good backup up and running between 15 minutes and an hour. So that's a major step for us. And that makes us about as ransomware proof as possible. The other thing that we're doing for ransomware and security is we're actually paying for penetration testing this year. We were, through a grant through CIS, able to pay for a spear phishing campaign with an outside vendor right before Corona hit, actually. And every user at the county was sent a bait email and encouraged to click on inappropriate things. We came back out of that with the results. They were good results in that they told us that everybody needs more training. So we'll be doing that this year as well. We'll be starting a yearly cybersecurity training requirement for new employees and existing employees. That will allow us to keep this top of mind for everybody. And just, I know it's a new requirement, but it is required by our insurance. So we will be doing that. We are also paying for a third party to attack our machines that are out on the public internet. So, and that is actually happening, or has happened, in the last 2 weeks. We're waiting on the final results, but as of right now, no major security holes were found, and we are as secure as we think we are on that aspect. And we're going to be doing this every year. We need to make sure that when we think we're secure, the outside thinks we're secure. So these penetration tests are very, very helpful for that. The cost is actually pretty low for what we get out of it. Our big struggle this year has been with remote workers. And I suppose you guys can probably expect that. We've had instances of remote workers letting their kids than we have historically. And the last thing we're doing is authentication. You guys haven't seen it yet, but you are on the list. All of our, what we refer to as high value targets, people in elected officials, directors, people with access to our financial data in an unrestricted way, those people are especially valued by the bad actors. So we will be implementing a dual factor authentication for computers, very similar to what you guys have seen with your email. So we've paid for the software. We've used it for 2 years now with the Sheriff's Department and with some in parole and probation, and it works very, very well. It ties with your cell phone, and that will protect you from, even if somebody gets your password and your username, they would physically have to have your phone as well to log into a workstation at the county. So it's really a great application. It's Department of Defense standard across the board. So we'll be hopefully doing that this winter, starting in January. So look for that. And that pretty much sums it up on our new projects for this. The things that we always do: long passwords, strong passwords, security patches, all of that continues to happen. These are just the new things that we have implemented this year. And then the last thing Commissioner Hunt wanted me to talk about was police cars. Our police cars are actually very secure. They come in 2 standards, one where the unit is removable from the car and one where the unit is locked in the car. Both of those are very secure. The units that come out are using 2-factor authentication. So if someone were to steal it, break into a car and grab it, they wouldn't be able to do anything with the equipment. And in many cases, they wouldn't even be able to format the equipment and sell it. It's just worthless to anybody else. So very, very secure. We have been audited on our cars by CJIS, and we are every 3 years. And we have passed that audit every time for the last 12 years. So I'm confident that our cars are in a really good shape. So any questions? I've kind of gone on a little bit. I know this is a special meeting. I don't want to keep you guys too long.
Thank you for that, Todd. On a related note, I just want to give you and your team a huge, huge thank you for all that you have done for the county and all of our employees over the past several months. I feel like, you know, we obviously talk about public health being big heroes in this, but IT has been a big hero behind the scenes as well, and getting a lot of our work to be done remotely, on helping us figure out what, you know, meeting platform to use, like the one we're using today, and getting people set up to work from home at a very, very rapid pace. So thank you so much for everything you've done on that front, and thank you for the information today.
Thank you. I appreciate it.
Yeah, Commissioner Hall, questions or comments?
Not a question. I just want to echo what you said, Commissioner Jacobson, that huge thank you to IT. You know, many people have had to step up in this organization and really everywhere during this crisis. But I think the efforts of our IT team to really gear up and, you know, how quickly we were able to get such greatly expanded telecommuting capacity in place is a tribute to that department's customer service ethic. You know, people in the community outside probably don't give county IT much thought unless they can't reach somebody at the county they need to reach by internet, by phone, through our website, all maintained by the good folks in County Information Technology.
Commissioner Hunt?
Yes, I think those points are well taken. Certainly the criticalness of our information technology department to the entire county cannot be understated. In theory, if the IT department goes down, the entire county can go down. So again, kudos to you, Todd, and to your staff for their hard work, not only in these times, but really whenever there's been a need to relocate a department, to update our systems. And the last thing I would say is, again, I asked for this presentation not because I'm particularly worried, but because I want to highlight how important the security of our network and our IT systems is, and to really highlight the good job that's being done. So thank you, and keep up the good work.
Well, thank you very much. I appreciate your time.
Thank you, Todd. All right, next up under commissioner reports, I have one brief thing I just wanted to talk about. So I've been in office, well, man, it seems like forever, but I guess about 1.5 years. And one of the things that came up initially that is still starting to maybe pick up some feet now, and I'm sure both Commissioner Hall and Hunt have been involved so long that they've probably been through this before, but a conversation about regional water supply, and specifically one at Rocky Creek, which has come up in the past between Newport and Lincoln City in the county. And I believe at the time that project was being looked at, the county was a supporter of that project for various reasons. It kind of fell by the wayside or just didn't have the energy anymore, but it is starting to resurface as a point of discussion. I am certainly interested in keeping the county at the table for that discussion and trying to just see where it goes and what information that we had in the past might still be useful and what isn't useful anymore. So I was hoping if we could have a consensus that we could just have staff draft a letter, just kind of saying that we are at least interested in staying a part of the conversation around Rocky Creek, no commitment of staff time or resources at this point, just simply stating that we are interested in seeing that discussion kind of pick up feet again.
I'd be happy to support that.
Yeah, I think you highlighted my concern, and that is staff time, but certainly the concept of being kept in the loop as far as what's being done, I think would be positive.
Okay, and I will say the reason this has come up is I know the city of Newport is beginning to talk about it. And they just wanted something, kind of formal or formal-ish that said we too were at least interested in being a part of the discussion. Okay, so I will go ahead and work with staff to just create some type of letter that we can all sign on to. Other commissioner reports, Commissioner Hall, do you have a report to give today?
No, I don't. Thank you.
Okay, Commissioner Hunt?
No, I have nothing today. Thank you.
Okay. Moving on to discussion and information, North Lincoln sanitary uniform rate reporting format and curbside composting service. I think Wayne Belmont from our county council is going to start us off.
Thank you, commissioners. And we have Tina French from North Lincoln Sanitary here to discuss the rate report and then also talk about the new service that they're proposing for our franchised areas. And as the commissioners recall, the county has franchises with both North Lincoln, Dahl Disposal for the East and South County, and Thompson Sanitary Service for the Central County. So we actually, in our franchise areas are really the unincorporated areas surrounding the areas that are served by each of the franchised entities in the cities. And so a lot of this discussion has already taken place with, in this case, with the city of Lincoln City. But it's our opportunity to use this uniform rate reporting format, which each of the entities have actually adopted. It gives us the data and information on which we approve rates that are being proposed. We try to do this on an annual basis. I know this one got messed up, and I apologize for this. This is really my fault. It got messed up in the all the COVID response. We actually had information to us a little while ago, but we're just now getting this on your agenda and on your radar. So with that, I'm going to turn it over to Tina, and I think you can see on the screen, Tina, we have the materials that you presented to us that includes the information that we'll review and the proposed new rates. So why don't we start there, and then we can move into the new service you're proposing.
Great. Good afternoon, commissioners. I'm Tina French, and I think everybody knows me. And I am here to talk trash, and I don't feel very justified after all the stuff I've heard today. Holy cow. But every year we provide you with this rate review, and we made an internal decision for a couple different reasons to delay the rate this year to September. At the time we did that, we fully expected to be on the other side of this COVID situation. And economically, I think we are definitely seeing a bounce back. I thought we would be further than what we are, but it is what it is. So this is the year, the even years are the years that we do CPI increases. And it's a little bit different, I guess, in your typical CPI. We take the 2 years combined, take 85% of that, which I believe brought us to 3.6%. And so in the county, one thing that I didn't put in your packet that maybe I should have shared with you, although it's really difficult to understand, I started keeping track of revenue by municipality, by commercial versus residential in February. And so that way I could have pre-COVID numbers and see where we were really losing revenue, what was holding steady, and then try to, the best we could, figure out where we were going to be going in second quarter, third quarter, and fourth quarter. Because as you can see in your packet, I can't scroll through this, right? You have to do that. Somebody does that.
Yeah, Christy will scroll down. So why don't you start scrolling, Christy?
So Christy, if you want to scroll to the actual.
Keep going.
There's our management salaries. That's part of the packet. So the first thing is here we go. So the rate review. So this spreadsheet is basically a combination of the actual cost of service for calendar year 2019, and then our best guess for budget cost of service 2020. And this looks at just the Lincoln County portion of our business. And so you can see in the white column, there's an allocation method for each expenditure. And so that's how we allocate each expenditure. Now, Lincoln County, unfortunately for them, they are very residential heavy and very commercial poor. Fortunately for Lincoln County, during COVID, we really didn't see much of a dip in Lincoln County's revenue during COVID, because obviously the biggest revenue shortfall for us, which was huge, was in commercial. And Lincoln County has very little commercial. So I'm looking, and I'm sorry you can't see this, but Lincoln County's portion of commercial is about 24% of the entire revenue, as compared with Lincoln City is at 53%, Depot Bay is 60%. So that was in March. And then as we moved across into April and May, we saw declines in all of those, but Lincoln County's decline was the least since they have the smallest portion. So what that does though is the residential has to carry the weight for Lincoln County. And so their revenue just isn't as high for the number of customers that we have in comparison to Lincoln City and Depot Bay. So that in a nutshell. So this sheet shows you all the expenditures, where we came in compared to what we thought we would come in last year. And then the middle column, the middle purple column, is the revenue adjustment. So either an increase or a decrease of what what we are basing the rate increase off of. So at the end of that, we need to fall into the range that's outlined in the ordinance, which is 85 to 92%, I believe, with a target of 88%. And so once we do the budget, if we're outside of that range on an odd year, then we do a rate adjustment to bring us back to that 88%. On even years, when it's a CPI, the CPI is instituted as long as it doesn't shove you out of the range, then that's where we keep it. Does anybody have, I know we've been through this a lot of times. Katie, I know you haven't a lot of times, but I don't want to spend too much time. I know you have a lot of stuff to go over, so.
Well, first of all, thank you for wading through an incredibly long meeting to present this today.
It's very informative.
I'm sure it was. I appreciate your patience, though. Commissioner Hall, questions?
No, appreciate the information, but I don't have any questions at this time.
Commissioner Hunt, questions?
No, informative. I appreciate it, but no questions.
And
I'm gonna have to run and get a cable for my phone, otherwise I'm gonna lose you. So I'm gonna vanish, but I'll be back.
Okay. I don't have any questions at this point in time either. It looks like this is just on discussion and information for today. So Wayne, do we bring this back an additional meeting for adoption potentially?
Yes, and Tina, I want to just confirm, you're looking at putting these rates in effect September 1?
So it would be for September service, and we bill in the arrears. So this rate adjustment will actually be on the October billing that is for September service.
And commissioners, what we've done in the past is with your consensus to move this forward, we'll prepare an order that sets the new rate schedule and get that adopted. We can present that at next week's meeting.
Okay, I'm okay with that.
I'm okay.
Okay, thank you for being here with us today.
We're not done. I'm sorry, we're not
sorry,
quite done.
go ahead.
That's the rates adjustment. Now, Tina
Okay,
needs to talk about actually a new service.
okay. Sorry, go ahead.
We have talked about it in the past, but we're excited about hearing about it, the proposal now.
Yeah, you are.
Oh, sure.
Disconnect and reconnect.
Tina, you're on fine. You're
We hear you.
we can hear you now, Tina.
And sorry about that. So I'm not sure where we left off.
Well, we're on the yard debris and composting program.
Okay, terrific. So, for several years, we have been talking about this. I'm going to guess 5+ years. We have been talking about a yard debris and composting program. And I have basically told Wayne, hashtag Lincoln County, that until Lincoln City signed on and was ready to do it, we really couldn't do a program in one of our municipalities and not our entire franchise area. And so in March of this year, Lincoln City approved this program that you have in front of you. And we presented them with a few different options for how to pay for it. And I'm going to say unfortunately, because it is unfortunate, they decided on the top bullet there under the details of a residential only rate increase of $6.85. The reason I say unfortunately is because once it skews the rates. So if you will, follow me through this for a second. If you are a customer that has a 96-gallon roll cart picked up once a week, that's approximately 2 yards of garbage a month. And if you are a commercial customer that has a 1 yard picked up every other week, that's approximately 2 yards of garbage per month. But now a commercial customer does not have a yard debris service, and so that amount of garbage is going to be less expensive than the residential amount of garbage. And so that's why I didn't want them to do a residential only rate. Lincoln City's council had an issue where they did not want a rate increase on commercial that was not going to have a service increase. And I understand that. I get that. Our solution to that was to provide, and I'll tell you why we're not doing a commercial program. It's horrendously expensive. Anytime you get into commercial food waste, the rate that we pay to get rid of this material it's unaffordable, and it's a non-starter for the program, quite honestly. Obviously, City of Portland does it, and I believe that they are the only city that requires commercial food collection at this time. But obviously, they have hundreds of thousands of customers to spread that cost over instead of hundreds of customers. So that's a big non-starter just from a financial impact. So what I thought we could do was provide commercial customers with a yard debris only can, because as long as we stuck with yard debris, the rate wouldn't change. Unfortunately, and quite honestly, I'm going to blame COVID. I think the communication got lost. It was all done through emails. There was no in-person meeting, and I think there was a misunderstanding, and so they passed the residential only rate, and that's what they're sticking with. And quite honestly, it has to maintain the same throughout our franchise. So I need Lincoln County to have the same rate structure as Depot Bay, as Lincoln City, because obviously, if you're a customer that lives in Glen Beach, you're in Lincoln County, but your neighbor lives a mile down and is in the city of Depot Bay, the rates need to be as similar as possible, or it's just a nightmare.
And Commissioner, if I might, Tina, that is traditionally what we have done with this service. We instituted this for the first time on Thompson's. We had discussions with the city. And again, because we're just the unincorporated area, we're actually a smaller player in the franchise rate than the cities, which have the principal amount of waste that's actually collected, or in this case, the compostables that would be supplied. So we've always deferred that discussion to the cities to take the lead in terms of the rates, and then discussed adding it on for the unincorporated areas, and had similar rates in the unincorporated areas as were found in the cities. So this is consistent with what we've done in other areas.
We have a fairly large customer base in unincorporated county. I think North County probably has the largest unincorporated customer base out of the rest of the county. And so we don't poo-poo our customers in the county at all. They're a large portion of our residential business. Obviously, Otis, Glen Beach, those are fairly high population centers for unincorporated counties. So we try to listen to those customers, meet their needs, no different than we would City of Lincoln City customers. They're no less important to us, or they do have some different needs. Obviously, some of them live on larger properties, but for the most part, we try to meet their needs the same as we do Lincoln City's needs. I know that I think all of you are probably very familiar with this program. It's, I believe it's a carbon copy of Thompson Sanitary, other than the frequency of pickup. We are going to offer this service every other week, the same week as recycling. So when you put your recycle roll card out, you put your compostable roll card out.
Okay, is there any questions from commissioners? Commissioner Hall, questions?
Not at this time, thank you.
Commissioner Hunt, any questions?
Tina, where does the compostable material go? Do you take it over to Coffin Butte?
Yep, it's actually across the highway from Coffin Butte Landfill. It's called PRC. I think some of you or all of you maybe have been there.
Okay, no, thank you. I think it's a good program. Glad to see it.
No questions for me. I will just say that I agree with Commissioner Hunt, Commissioner Hall, good program to expand into other areas of Lincoln County. I'm a big fan of the compost bin because I have a place to put all my fish carcasses. So I really like it.
I won't tell your driver that.
Yeah. We've checked with Thompson's in the district to make sure that was okay.
No, it's
We were told yes, but
No, it is actually, that's great material to have in there, that, super nitrogen rich material. We pick up entire yard and a half of fish carcasses, so it's totally fine.
I'm a fan.
Chair Jacobson, I thought you threw the fish carcasses in the garden.
On a
That's
good
the
day of
roundabout
fishing, on a good day of fishing, there's too much for the garden, right? So you got to have some place for them to go.
They'll
Understood.
actually end up back there.
Yeah. All right. Well, thank you. I think we'll.
Commissioners, if I might,
Yeah, go ahead.
for this is a new service. What we do need to do is solicit public comment on this.
Okay.
And then bring this back, and we would actually do a separate order if there's a consensus to move this forward to establish the new rate and the new service. And again, Tina, you're looking at March of 2021 as an effective date, if I
That's
remember.
correct.
Okay.
Yep. So we're looking at delivering roll cards probably the last 2 weeks of February, and the collection will actually, and the rate will begin on March 1st. So again, the rate goes into effect March 1st. The first billing for the rate would be April 1st.
Okay, so we'll do a little notice and solicit public comment on this, and then see where that goes and prepare an order if that's the consensus of the board to move it forward to establish that with that particular time frame.
That's good. All right. Thank you for being here with us today, Tina. Appreciate the information.
Thanks for having me.
All right. Before we adjourn today, just want to make sure there's nothing else from commissioners. Commissioner Hall, anything else?
Nope. Thank you.
Okay. Commissioner Hunt, anything?
No, nothing. Thank you.
Okay. Is there anything else from staff?
Nothing.
No. Okay. With that, we will go ahead and adjourn. We do have our kind of regularly scheduled Board of Commissioners meeting Monday, August 24th, 2020. As well as our joint session with the City of Siletz for Wednesday, August 19th, 2020 at 5 p.m. But as discussed previously, we will be scheduling a meeting for probably Thursday afternoon or evening to discuss possibly information we received back from the governor's office and OHA regarding our phase 2 application. So that date and time has not been set yet, but we will of course send it out for a press release when it is set. All right, with that, our meeting is adjourned. Thanks, everybody.
Bye.
Thank you, commissioners.